Red yeast rice is commonly used to lower cholesterol levels. However, some supplement products may contain harmful impurities or additives. It's important to check with your pharmacist for more information about the specific brand you use. It's also important to note that the FDA has not reviewed red yeast rice for safety or effectiveness. It's recommended to consult with your doctor or pharmacist for more details. The typical daily dosage of red yeast rice is around 1,200 to 2,400 milligrams, taken in 2 divided doses. It's best to take it with food to improve absorption. It's also important to note that red yeast rice should not be taken by pregnant or breastfeeding women, and should not be combined with certain medications, such as statins. Always consult with your healthcare provider before adding red yeast rice to your daily regimen. When taking red yeast rice, it is recommended to consume it with food. Make sure to follow the directions on the product package or the instructions given by your doctor. If you have any questions, it's best to consult with your doctor or pharmacist. It's important to avoid consuming grapefruit or grapefruit juice while using red yeast rice, unless your doctor or pharmacist has advised otherwise. Grapefruit can potentially increase the risk of side effects when taken with this product, so it's best to seek more information from your healthcare provider. If your condition does not improve or worsens, or if you suspect a serious medical issue, it is crucial to seek immediate medical attention. If you experience abdominal or stomach pain while taking red yeast rice, it's important to let your doctor or pharmacist know. Additionally, be sure to seek medical attention if you experience serious side effects such as muscle pain, weakness, signs of kidney problems, or signs of liver problems. While rare, a serious allergic reaction to red yeast rice can occur, so seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so be sure to contact your healthcare provider if you notice any other effects that are not listed. Before taking red yeast rice, it's important to talk to your doctor or pharmacist if you have any allergies or if you have liver disease, kidney disease, or if you consume alcohol. It's also important to inform your doctor or dentist about all the products you use before having surgery. Limiting alcoholic beverages is recommended as daily use of alcohol may increase the risk for liver problems when combined with red yeast rice. It's important to note that red yeast rice should not be used during pregnancy as it may harm an unborn baby. If you are pregnant or think you may be pregnant, inform your doctor right away. It is also uncertain if red yeast rice passes into breast milk, so it's recommended to consult your doctor before using this product while breastfeeding. When taking red yeast rice, it's important to be aware of potential drug interactions. This means that it could change how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Red yeast rice may interact with drugs such as azole antifungals, blood thinners, macrolide antibiotics, nifazodone, ritonavir, and telithromycin. It's also important to note that some red yeast rice products may contain a statin, cholesterol-lowering drug called levastatin. Taking too much of a statin can increase your risk of serious side effects, such as muscle and liver problems. If you are already taking any statin drugs, it's best to avoid taking any red yeast rice products. It's important to be cautious and consult with your healthcare provider before starting red yeast rice, especially if you are taking any other medications. Always prioritize your health and safety. If you suspect an overdose or experience serious symptoms such as passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Be sure to attend all your scheduled medical and lab appointments. In addition to taking red yeast rice, it's important to maintain a low cholesterol/low-fat diet and incorporate regular exercise into your routine to help control cholesterol levels and reduce the risk of heart disease. If you need more information on how to do this, consult your doctor for personalized advice. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take the next dose at your usual time. Do not take 2 doses to make up for the missed one. Make sure to check the storage information on the package before using red yeast rice. If you have any questions about how to store it, you can ask your pharmacist. It's important to keep all medications and herbal products out of reach of children and pets. When it comes to getting rid of this product, don't flush it down the toilet or pour it into a drain unless you've been told to do so. Instead, make sure to properly dispose of it when it's expired or you no longer need it. Your pharmacist or local waste disposal company can give you advice on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.